This video is for people who are suffering with shin splints. It's a really frustrating condition for people and it can stop you doing your running or your sport. In this video, we're going to go through exercises that you need to do to help get this sorted. But apart from the exercises, it's also very important how you manage your overall load and your training and your exercise. It's not as straightforward as just do these exercises and ignore everything else. Some of the things we're going to talk about in the video are the treatments that you might have tried and failed to do, what's important along with the exercises, how you manage it yourself. But let's start with the exercises and we'll go through them now. Okay, so the first exercise here is the fall forward exercise. It's a little bit technical. I need you to feel it in the sole of the foot here. Now, as the exercise goes on for 30 or 40 seconds, you certainly are going to feel it up through the calf as well. So set yourself up close to a wall. It's fall forward, but don't fall over. So stay nice and tall. If you break at the hip or that, it takes pressure off the foot. Falling forward. Now my heel is about to come off the ground, but it doesn't. In this position here, if you're struggling with balance, have your fingertip there, trying to get your nose close to the wall. And now I'm putting a lot of pressure down through the ball of my foot. So you should feel your toes grip the ground, and as you stay there, push to the ball of the big toe a bit more and you'll feel the arch in your foot working like that. So you stay like that for 30 to 45 seconds. Take a little break, maybe do about 5 or 6 reps in a set. That's the first exercise, targeting the sole of the foot. Okay, so the calf raise exercise here. I know stretching your calf is very popular for shin splints, but in this, there is a stretch effect happening to the calf as well. So, get your ball of your foot on a weight, nice and tall, up as high as you can, and all the way down. Focus on pushing to the ball of the big toe and the toe beside it. Now go to the point where you cannot do any more. I have a 15 kg weight in my hand here. You should feel your calf working hard. I'm not going to give you exact reps. Go to the point where you really can't do any more. And then when you can't do any more, leave the weight down and continue on with body weight. So the purpose is to really load up the calf and go through full range. Okay, so the first 2 exercises have worked in the bottom of the foot and the calf. Now we're focused on strengthening these shin muscles along the front of your leg here. So there's a number of ways of doing this. I'm doing this with a 4 kg kettlebell. My leg is relaxed and I'm pointing my toes down as far as I can, pulling them up as far as I can, hold it for about 3 seconds and slowly all the way down. And again, this is where people fall short, is when it comes to dosage. Most people love hearing 8 reps or 12 reps. Don't limit yourself that way. Go to the point where you only have 2 reps left in reserve. So you're going to a good 8 or 9 out of 10 effort, and you should feel a lot of burn and activity through this muscle here. So the first few exercises have worked directly on that area from your foot up towards your knee, between your foot, your calf and your shin. Now it's also important to load up the entire leg, but we're going to do that while we get the foot and calf also working a little bit more. So as opposed to just doing a straightforward reverse lunge here, we're going to put half of our foot on this, so the ball of your foot will be on it. The dumbbells will go down your shin, and from that bottom position, you push down through your left foot. So all the intent is here. Now I'm not just passively waiting here like this. I'm pushing through here, so my heel is up a little bit. I'm pushing down through the ball of my foot, driving up. And there, you're working your entire leg with a little bit more focus through that shin area. So I'm going to use the deadlift as an example here of just general loading. It is good to lift heavy if you're able to lift heavy. If not, don't worry about it and just focus on the first 3 exercises that we did to work on the foot, the calf and the shin. But apart from that, we're doing those local ones and then we are working the entire leg. So lifting heavy is always a benefit to shin splints as well. So it could be deadlift, it could be squat, and you're going with your strength work. Go as heavy as you as heavy as you can cope with for 4 or 5 repetitions. Okay, so they're the exercises specific to that area, and you could put it in 2 categories. One's local enough to the sore area, working your foot, your calf, your shin, and then general loading of your leg. So heavy strength training, if that's something you're used to, absolutely is important to keep going with that. If you've never lifted before and done any weights, don't worry too much about that, but everyone can load up this area pretty much from their foot to their knee. But apart from that, if people just did those exercises, they mightn't necessarily get better for these reasons. So people are trying to get treatments like needles and rubs, resting. And while your symptoms might reduce, as soon as you up the load again, it gets sore, and that doesn't work. So you think, okay, my pain is gone, but then you're back doing your activity and it comes back, and that can be soul destroying, very frustrating. So there's a couple of things that we need to talk about here. While I've given you exercise before which completely increase the load on this foot and leg and calf, you also need to decrease the things that are annoying it. So runners don't like hearing this, but if you are running and that's annoying it, you absolutely need to step back from your running. It might mean you need to take a week or a couple of weeks working on your fitness on the Airdyne bike or the rower, something that works your heart and lungs, but not running or jumping on it. You have to step back from there. But while you step back from there, you're also increasing the load on this area. Now, at a certain point, you need to gradually reintroduce your running, but you need to get pain-free. One of the tests we would do is, are you able to hop 20 times on each leg and feel fine on both sides? That would be a marker of, okay, now I can start running again. When you start running, you can't go back to, oh, I'm on the pitch, or I'm running 5 days a week and I forget about the exercises that I've done. So you'd have to go back to maybe running twice a week. You warm up well with your rehab. You're still doing probably 3 days of heavy work to strengthen up the areas around it. And then once you get a week or 2 of that, then you can increase your load and your dosage with your running. So to summarize this, to sort out your shin splints, you might have to pull back from some of the things that are annoying it. The second thing is you have to really increase the load and the strength and the tissue tolerances of all the muscles from the bottom of your foot all through that leg, but especially in around your calf, shin, foot and ankle. General strength training is important to keep going with that. If you have any questions on this, you want to comment below or send us a message, we'll be glad to help. Thanks.